All potential parents who want to undergo a surrogacy program have different medical conditions. Depending on these conditions, we offer 4 types of programs. 1 with their own eggs, 2 with donor, and another with frozen embryos. Typically, programs use the sperm of a potential dad, but there is one exception when we can use donor sperm. I'll tell about it later. Let's talk briefly about which program is best suitable for every category of participants. Let's start with what they have in common. Firstly, each program includes medical examinations for parents, surrogates, and donors. The price also includes IVF, pregnancy care, organization of the birth process. An exception is the program with frozen embryos. It is logical that part of the procedures, for example IVF, is not required in this program. Secondly, we fertilize eggs using the ICSI method. Compared with traditional methods, ICSI significantly increases the chances of pregnancy. Thirdly, all embryos undergo pre-implantation genetic diagnosis, PGD. During the examination, we can see whether the embryo has chromosomal abnormalities, such as Down or Patau syndrome, or not. And, of course, we will find out the gender of the future baby. If we manage to get some high-quality embryos, parents can choose which one to transfer, a future girl or a future boy. Fourthly, regardless of the program, such specialists as nurses and pediatricians will help you after the birth of the baby. They will tell you how to care for a newborn, how to feed him, what kind of daily regime you should stick to. Now let's talk about the differences. So, the program using your own eggs is called Victory. We take the egg of the potential mother, fertilize it with the sperm of the potential father, cultivate the embryo, and transfer it to the uterus of the surrogate mother. We recommend this program if a woman has tubal, peritoneal, uterine, or cervical infertility factor. It includes obstruction of the fallopian tubes, adhesions on the endometrium, changes in the cervix, and other conditions. That is, a woman has healthy eggs, but pregnancy does not occur naturally. If her husband has high-quality sperm, the Victory program fits very well. In some cases, we can use donor sperm if the potential dad does not have viable sperm, or if his health does not allow sperm to be donated. Ukrainian law allows this because the child will have a genetic relationship with one of the parents. In this case, he will have a genetic relationship with mom. Therefore, if the law of the native country of potential parents allows to establish kinship on matrilineal descent, we can use the sperm of the donor. As a result, we get the ideal formula: a healthy egg plus healthy sperm plus healthy surrogate mother. In this case, the chance of success is very high. Before the couple arrives in Ukraine, we collect as much information as possible: medical certificates, medical records. Our doctors need this information to analyze the situation of a particular couple, the reaction to different types of treatment. Thus, the doctor will be able to improve the ovarian stimulation protocol. Upon arrival in Ukraine, potential parents are examined in a clinic. A man donates sperm and blood for infection tests. A woman also donates blood for infections and hormones, and also undergoes an ultrasound. After the examination, the doctor prescribes a protocol for ovarian stimulation. A potential mom will take hormonal drugs that will help get mature cells for fertilization. Stimulation lasts 14 to 20 days. It is better to spend this time in Kiev under the supervision of our doctors. After 2 to 3 weeks, doctors collect eggs. After the puncture, they fertilize them with the sperm of a potential dad. 1, 2, or 3 very healthy embryos are transferred to a surrogate mother. The next program, Success, is carried out using the egg of the donor and the sperm of the potential father. In this program, we get about 15 to 30 eggs from the donor. We recommend the Success program if a woman has had her ovaries removed or does not have her own healthy eggs. This happens with hormonal disorders, early menopause. In this case, the parents choose a donor woman who looks like a potential mom. In the Victory and Success programs, we make one attempt to transfer the embryos. According to our statistics, 4 out of 5 attempts in programs with donor oocytes are successful on the first try. In case of failure, parents can make another attempt or move to the guarantee program. In this case, couple pays only the difference in the cost of programs while maintaining the first payment. Guarantee is our third program. We also use donor eggs and sperm of a potential dad under this program, but we perform IVF and embryo transfers as many times as it takes to have a baby. It means that in this program, parents are insured against all risks that may arise during fertilization and pregnancy. If the embryo does not attach after transfer, a second transfer will be conducted. If the pregnancy fails, then we will repeat the program again. We recommend this program to couples who have good sperm indicators, no karyotype abnormalities, and sperm DNA fragmentation is normal. We always recommend that men first take these tests in their country so that the couple knows in advance whether they have a chance to join the guarantee program. A man will again pass these tests in Ukraine, and if they are normal, we will be able to start the guarantee program. And the last, fourth, care program is for couples who already have ready-made frozen embryos. Parents send them to Ukraine by special courier service. Here, our doctors thaw embryos and transfer them to a surrogate mother. There are several documents that parents must send along with frozen embryos. There will be detailed information about this in a separate video. All details of the programs are described on our website, and if you have any questions, please call or write us.